I'm Kristen with Head, Shoulders, Teeth, and Tongue, and today I've got Dr. Brittany Johansen, and she is awesome. She is highly skilled in airway dentistry, and that is all she does. She doesn't do any regular dentistry like you would think, like fillings, crowns, like all those kinds of things. She focuses on airway, and I'm super excited for her to be here with us because she knows all about it, and she's helped so many people with snoring, with jaw joint issues, which is called the TMJ issues. She's been helping people reduce their breathing disorders of other kinds while they're sleeping, because it's not just snoring and sleep apnea, right? There's other things that can be going on. And she's very thorough, and she makes sure that she really can help a person before she starts. And so I'm excited to hear what she has to say. Dr. Brittany, tell us just a little bit about how you got into this.
My mom, bless her heart, love you, Mom. She would fall asleep in the dental chair all the time. And that got really concerning. And so I was like, well, let's figure out kind of what's happening, because I started learning about sleep apnea and how the airway really affects that. And I wanted my 3 beautiful kids to grow up with their grandma. And so I was worried for her, and I learned more about it. And she's been a big motivating factor to continue to learn more and all the different things. And so as I started helping my mom, I thought of all the other people that I could help with that. And I liked general dentistry. It was really fun, but I love, and I have this passion for airway dentistry because it can make a big impact in someone's life.
Thank heavens, because we want our grandmas around. So tell me just a little bit about what are some of the things that you're checking when someone is concerned about their sleep, or maybe their spouse has told them that they ought to be concerned about their sleep or something like that. They come see you. What are you going to do to check to see if you can help them specifically?
Yeah, great question. So I am looking at 3 main things that I'm going around and doing. I'm doing a home sleep screening just to see, hey, quantitatively, what is your sleep like? So you can tell me that you don't wake up feeling well rested in the morning, but I want to see how many times do you actually stop breathing, and how urgent is this? And do we need to get a medical colleague involved, like right from the get-go? Or is this something that we can go through expansion, and I'm confident that that's going to help as well. So there's multiple different things, but the home sleep screening is one that I do. Then I also look at a comprehensive exam. During that comprehensive exam, I'm looking full head and neck, looking at the tongue, the teeth, the joints, the sinuses, the airway, everything with that. And then I'm looking at a 3D x-ray, and that 3D x-ray goes all the way around your head. And then it volumetrically allows me to see the airway, the joints, the sinuses, the septum, and the teeth.
I have had some people ask me, how do I know that what you are going to do for me will help me? And it's true, like, you know, we both can help people with sleep, but unless we have that as home assessment or that x-ray that goes around the head to really see what's going on in the airway, how would we know? So I love that you are taking that on everybody that's coming in, because let's find out, because maybe it's a vitamin deficiency like vitamin D, or maybe it's something else, right? And the airway might be fine, right? And so you need to go send them off to somebody else if that's the case. And so that's fantastic that you're doing such a thorough exam on everyone to make sure that you really can be fairly confident in helping that person.
Well, actually, as dentists, we're poised in the best position to help out with a lot of those things that are going on, as long as we can probe and ask the right question. And all of that can tell me a part of the big picture. And there's some specifics that we can go into later about what, like on the teeth, what we're looking for, and on the tongue and everything else. But I'm looking that whole system, the cranio-facial system, but I'm also taking posture pictures. I'm looking to see, how do you hold your body? How is the weight distributed? What are some different strengths I can see? And do we need to also get someone else on our team, a chiropractor or a body worker, and other things like that. So those are the main ones.
That's awesome. That is fantastic, because I would like to get into some of the details here, and knowing kind of what you do to help a child. On your website, you've got several details. You said that you use MyoBrace, and which sounds kind of like braces, but it's not, right? It looks kind of like a mouth guard on steroids, and it's amazing that this is going to help with expansion. But could you tell me just a little bit more about how that works and when you use it and kind of what goes along with that program?
Sure. So I have my box of demo models here, and I can show this is what a MyoBrace is. And I really like the MyoBrace for kids because it's helping teach the proper muscle habits. So myofunctional therapy, which I send some of my patients to you to get some of that done as well, really is important as well. And this appliance is just helping sock in some of those different things that we're trying to teach. So this is a tongue tab. The tongue goes up to touch that tab at the proper spot. If you say the letter N, your tongue should go behind your central incisors. And then if you just lay your tongue up, that's how it should be resting on the roof of your mouth. This helps elevate to get that tongue into that position. And these help the lips and the cheeks from being overactive. So why that's really important is the tongue can exert up to 500 grams of force on the roof of the mouth, the palate. Well, if your tongue isn't sitting on the roof of your mouth, thumb sucking habit, bottle habit, binky habit, low tongue posture, well, now the lips and the cheeks are taking over, and the lips and the cheeks can exert 1 to 300 grams of pressure. So in a fully cohesive system, you're still getting expansion because 500 outweighs the 1 to 300. But if your 500 isn't going up to the top, if the tongue isn't to the roof of the mouth, the lips and the cheeks are winning. And now you get that narrow palate, high vaulted arch, and the roof of the mouth is the floor of the nasal sinus. So if you're squishing that, you're also narrowing up your nasal breathing space. And we can talk all about the importance of nasal breathing, but your tongue is an important scaffold system of the maxillary bone. So I really like MyoBrace because the muscles are setting the tone for the bone. So we really want to teach the muscles where to go. Also, what the MyoBrace does is it helps keep that lower jaw just slightly forward. So when someone goes to sleep at night, that jaw isn't falling backwards. And what that can do, bringing your jaw forward, your tongue is attached to your jaw. And if you bring that lower jaw just slightly forward or don't let it fall back, the tongue is up and out of the airway, helping you breathe better at night so you can get your full cycles of sleep, which is so important of all those other things. MyoBrace is pretty cool. There's a lot of other systems out there, and they're brand names, Kleenex, tissue, things like that. So I use MyoBrace because that's what I've started with, and that's where I've seen the results. But very similar other growth guidance appliances can do similar things. And if you have it with someone who's doing the right protocols, nasal breathing, myofunctional therapy, and what we've added in our office as well would be cranial manipulations just to help the bones in the head to align right as well. So there's a lot of other things that you can add on top of that, but the growth guidance appliances are great.
Another patient asked, why does that, and you kind of alluded to this just a little bit when you mentioned that you've got this growth system, that you also, use some cranio-sacral therapy, and in myofunctional therapy. Why does it take so many systems to get this to work? Like why, when they come see you and then, sometimes they're referred to me and then sometimes, they need cranio-sacral or they need maybe like a chiropractor or something else. Like why? Why do I need all this stuff to fix this area right here? That's a great question, right? And so I was hoping I could get your input.
Yeah. So what's housed in your head? Your brain. And what do you need to function and to thrive and survive? All of the proper brain functions. So you have 12 cranial nerves, and those cranial nerves, here's my little fun guy here, they run all throughout that system. So here is the maxilla, and this supports the orbit, supports the brain, supports the posterior portion where all the nerves are running through, and also the maxilla itself. And so, yeah, we're talking about teeth, But like I was saying before, dentists and hygienists and myofunctional therapists are in a really great position to affect the rest of the body, because oftentimes if you're going to have problems along your spine or other things, a lot of things start ascending. So you stack the head on top of the shoulders, on top of the head, shoulders, knees, and toes, right? Sometimes your toes can affect your knees and your hips, but most likely it's your hips that are going to affect your knees and your toes. Well, what's the start of that chain?
Mm,
The jaw joints. And what's a big portion of the proportions of the whole craniofacial region? The maxilla. It's that keystone with different things, because it articulates with so many other bones in the head through so many other different connections. And chiropractors help with that, cranio-sacral therapists help with that, dentists, whether they know it or not, really affect that as well. ENTs. And so there's a lot of different ways. There's a lot of different ways to get from point A to point B. But where I find the stability in the system is when you go to a chiropractor, it's really great. They help align your spine. Now you're getting better neurology and nerve flow and blood flow through that. But what can throw it back out of whack? Those muscles. Well, why are the muscles overcompensating? And oftentimes it's because of the way your teeth are coming together or not coming together, because they have that ability to throw off that system. And so when I see someone get treatment to balance out their jaw, their chiropractic treatments hold better and hold longer, because the occlusion is the stabilizing force.
yeah.
So it's pretty amazing. When you bite together, there is a periodontal ligament that is around the roots of those teeth, and that nerve signal and impulse is sent directly to the brain. Oftentimes, if I'm trying to move my arm or other stuff like that, it's sent to the spine, it synapses, and then it goes up to the brain. And so there's a couple different pathways it goes. Well,
Mm.
the teeth are going straight to giving you some sensory input. And so they're just really a big stabilizing or destabilizing force of the whole craniofacial system. And that craniofacial system is the top of the body and the spinal column and everything else. So that was a long answer that everything works together, and your head can really affect your toes.
Yeah. And I love that you got a skull because I've got, something with all the muscles, right? Because as a myofunctional therapist, I'm working, myo means muscle, right? And so I'm always pointing out, this muscle and this muscle and this muscle. And then also pointing out, hey, if the airway is not open, right, then all because all these muscles are then being pushed into the airway. Why? Because the jaw is so small. And there's, the sign of like crooked teeth or crowded teeth is a sign that the muscles are not supporting that. And I'm constantly explaining that. So yeah, you explain it very similar to the way I explain it, is all of these systems, right? The bone system, the muscle system, the nervous system, which is, all the nerves, those all have to work together. And if they're not working together as we grow up, then we're going to be constantly compensating. And then we have to work on all of those things to get you back to healthy. And so that's why it usually takes multiple providers if a person grew into poor function and poor structure to fix that. We want to fix the function and fix the structure, and that it all supports each other. So I love that. That's awesome. So you mentioned chiropractic work just a little bit. Who are you training with to learn more about this?
Yeah, so all the cranial manipulations, all the stuff that I've learned about how the sutures work and how to get the head end torqued, I've learned through Dr. Bob Walker. He teaches the course Exceptional Exceptional Dental, and it's chirodontics. It's really cool because he's a chiropractor and his significant other is a dentist. And so they've figured out how to marry the two together and how to get the whole craniofacial system working better. And so I've just really loved learning more from him, and it's been a great addition to my practice.
That's awesome. Look at you putting all these systems together. A couple other questions. What is a tongue tie and or a lip tie? We talk about both. And then if it's not caught when a person is a baby, does it really affect an adult? Do we have to do anything about it if it's not caught then?
Publicity about tongue ties, even though they've been around forever. Back in the medieval times, the midwives used to have a long fingernail to clip that. Used to be a common thing. Now it's not done in hospitals anymore, but hospitals in Brazil are doing tongue tie releases for infants in the hospital so that they can nurse better. So it's been around for a long time, but it's kind of trending again, right? But you want more knowledge so you don't just get caught up in the trends, and you want to be doing it for the right reason. So the tongue tie is part of the myofascial train system, and it runs from the tip of your tongue all the way down to your toes. And so if you stick your tongue up, it's that guitar string underneath your tongue. Well, when is that an issue and when is not an issue? Really, really great question. And I think a lot of different providers have different answers for that. So I'm going to tell you my opinion and my viewpoints with different things. So if you have a newborn baby and they're struggling to nurse, then take a look at the tongue ties and the lip ties and everything else like that to see if it's not allowing the lips to flange out all the way. And so the baby can't express the milk enough, or maybe the baby's expressing milk just fine, but the mom is in pain, and that's no fun either. So there's a few different reasons why. So as an infant, you can look at getting that tongue tie release, and they're able to get that procedure done fairly quick and painless with different things. Well, and then now you go into the next age group that might be that 1 to 4 years old, where now they might struggle a little bit. And are the benefits of getting a tongue tie release, do they outweigh the risks of if you needed general anesthesia to get the tongue tie release done or other things like that? And so then I'm going to look, hey, what are the symptoms and what are the reasons why we're doing it? And then we can look at that. If they're going to be put under for other reasons, maybe the ENT is looking at doing a tonsils and adenoid removal, which I have different opinions on as well, getting the tongue tie done at the same time. So we always look to get the maximum benefits, the most comfortable, efficient, and effective means to get to where you're going. Then you're looking at the adult population or older. So then you're looking at the kid population. So getting your tongue tie release from 4 on up is a little bit more simpler in the office. And then, and why are the reasons, and I'll go over the reasons why I would do it at that age. And then as an adult, why would you do it at that age? So I think the answer is different for every age demographic, for every case situation. And you can't just say yes or no. Refer my infants to go get a tongue tie release done at a colleague's because he has a IBCLC, a lactation consultant, in his office. And I'm like, that's the way to go with everything. If you could also get and maybe an osteopath or a cranio-sacral therapist on that team as well, then you're going to get better results. And so since he already has those systems set up in place, I send the infants out over there. So we're looking at the ability to suction, and we look at the actual physical length of the restriction and everything else like that, and breastfeeding. Then for the 4 and up demographics, I'm looking, are you able to clean your teeth? If you have a lip tie that's so tight and you can't clean your teeth really well, we're setting you up for not having good oral hygiene. So yeah, maybe we do get that one done. And we look to see, is that tongue, we talked about that tongue being the scaffold and getting up to the palate to help expand that palate. Well, can that tongue go up and help expand it? If it can, maybe we'll look at doing a tongue tie release then. And then in adults, a lot of their growth has been completed. We can still cause some great changes even in adults, but to what end? So I always look at chief goal. Sometimes my patients, when they come in for a consultation, I'm like, okay, What is the reason why you're coming in, and what would you like to see as a win at the end of your treatment? And if the tongue tie release isn't fitting into that, even though they have a tongue restriction, I may not recommend it. But if they have all those other signs of headaches, which was my reason to get a tongue tie release, and it reduced my headaches by 75%, which is amazing. Or a acid reflux, or sleep, or a lot of other things that can help out with that, then we'll look at doing it as an adult. However, before you free up the tongue and give it the freedom to move, you want to make sure it has the space to move into. So especially for adults. For kids, even if they're narrow, that tongue, because they are so malleable, is going to help create that space. In adults, if you free up the tongue, you can actually make sleep apnea worse, because now that tongue has that ability to flop back and block off that airway a little bit. So every case is really different. And to just say, do I have a tongue tie? You probably do. Do you need to get it done? I have no idea until we go through all of the different reasons why you're wanting it done, the measurements, your sleep screening results, and a lot of different things there. And that's not even to go touch on the point of you want the strength and ability to, before you get it done with myofunctional therapy, and you want to continue that strengthening and that stretching after, so that it's a successful release and it doesn't reattach back.
That's awesome. Yeah, that's so important to realize that just because someone has a tongue tie doesn't mean that we just release it, right? We got to figure out, is this affecting you? Because if it's not affecting you, why should we do anything about it? Let's leave it alone, right? But if it is, and it's difficult to know how it's affecting a person until we've done all the screenings, right? Because I've had so many patients who are like, it doesn't cause me any pain. And I'm like, it's not going to cause you any pain right there in your tongue tie. That's not what we're looking for. We're looking to see what your tongue can do because it's so tied down, or what it can't do because it's so tied down. And is that affecting other things in your systems? How would a person know if they should bring their child in to see you?
Yeah, great question. So, do they need expansion or not? And all these questions are going through parents' heads with everything. I do complimentary consultations just so I can let my patients know what it is I do. And sometimes they don't even know, oh, these two things are related: bedwetting and poor sleep and a small airway. That's all related. Oh, so really just being able to learn more is valuable in and of itself. But if you're going to be talking statistics and numbers, if you say, does my child need expansion? The short answer, yes. The long answer is, because of our society and the way that things are trending with our processed foods, our shorter times breastfeeding, our longer times bottle feeding, binky habit, thumb habit, the environmental toxins, and a lot of other things. These are all environmental factors. And now compound that with some genetics as well. They did a study in Brazil of 6,000 kids, and 93% of those kids had some form of malocclusion, crooked teeth. So 93% of these kids need some type of expansion. And that was, it's 6,000 kids, which is a pretty good pool, not just one or two kids. But really, if you look around, there are so many people that have braces nowadays. And is that just a genetic thing? Oh, my mom had braces, so I'm going to have braces. I'm saying it's an epigenetic thing. It's how the environment has influenced the way that our genes are expressed. It was interesting. I went to the USS Yorktown in South Carolina, and I was looking at these pictures of these World War II soldiers, and they had these big, broad smiles, and I was like, I don't know, braces wasn't that common back then with different things. They had, and how short of a time now where 93% of kids have some form of malocclusion. And if you look at anthropological studies, which is noted in the book Breath behind you by James Nestor, that if you look at the Paris catacombs, if you look at the Egyptian tombs or other things like that, there is a skeletal difference between how our skeletons are structured now versus how previous were. And specifically looking at the maxilla and the airway with other things, they had room for 32 teeth, wisdom teeth included. And now we don't. We routinely get our wisdom teeth pulled. Well, what's next? Are we going to get the second molars pulled, or are we going to get the first? Like, how constricted are things going to be? Because our diet is changing, where we are not using our muscles as much. So our muscles aren't causing our bone to grow as much with different things. So the quick answer is you probably fall within that, at least that 93%. And I think that's probably a low value. Or, hey, if you're that unicorn and your kid has beautiful spacing between all their baby teeth, a nice wide smile, no trouble sleeping, no, you're great. That's awesome. You should go buy a lottery ticket.
I love it. Yes, indeed. Tell me just a little bit about what it looks like for an adult. A lot of patients are told that they can't have expansion as an adult unless they have surgery because they've stopped growing. So they can't do it. And so what have you learned?
I get adults developed and expanded every day. It's a lot of fun, and through non-surgical means. So there are 3 different ways that you can be constricted. You can have a dental constriction. It's all just about where the teeth are at. You can have a skeletal constriction, which is like, the bones itself are not an ideal size. So now we need to figure out how we can promote that bone growth. That's a little bit longer and harder. And that's where there are surgical options for that. Or is it cranial, which is really quite fascinating. So you have 22 bones in your head, and where those bones meet is called a suture. And those sutures are all along your whole head and right down your maxilla as well. So suturally, we can get change. If you think of a cardboard box, I'm not changing the lengths of the sides because that would be a skeletal discrepancy, but I can change the location of them by mushing that cardboard box and making it into a parallelogram. Well, now it's not functioning as good of a box as it should be, and the bones aren't in the sides aren't in the right place. But we can take that, and with some manipulation, really gentle and light touch manipulations, we can make that back into a box, a good functioning box. And that's actually what we can do with the cranial bones as well. So I'm talking about this during the expansion phase because do you have a cranial distortion? That's a pretty fast fix that we can do. A dental distortion, it's going to take a little bit of time to move the teeth, but you can move that whole process of where the bone, the teeth are all connected and we can get that wider. Or is it a skeletal issue? Again, that one's the harder one to fix. So we get that in adults all the time. And the cranial manipulations we can do all the time too in adults. Those sutures are not fused, because if they were, we get in a car accident, you bang your head, it shatters. If they were fused. They're not fused. So what they do is they take that force and they distribute that trauma along all the movements of those sutures, which is not healthy, but it allows you to survive. So now we want to undo that trauma and then get that aligned up well so that we can get the nerves traversing through the right spot, so that when we go to develop and expand that the sutures are all aligned in the right spot and we're not locking you in a contorted place. So we get expansion a few different ways in adults. One of the ways is to do it with an acrylic type expander. And the acrylic is great because it gives the grunt of it. So the acrylic can help really move a lot of those cranial bones and to help get that expanded. If you are overlapped, we just push and we can help open up that area there. Or if it's just moving teeth and the whole tooth process, the whole dental alveolar process, I use clear aligners. And these clear aligners are switched out every 2 weeks just to get a little more expansion, a little more expansion. That's important because we want to create that tongue space so that the tongue can live on the roof of the mouth instead of living in the back of the throat, blocking off that airway. So it depends on which type of expansion you need and what your main goals are. Always going back to the why. And on my consultation notes, I have the chief complaint, the health history, the why, the when, and the what. And so like, I want to know what's your why for starting treatment and what's your when. This is the goal that you want to see achieved so that you would be happy and you'd feel like treatment is successful. If you tell me something in that when that I'm unable to accomplish, I tell you right then and there, that's not something I do. Maybe you need to go look for another place. That's not it. That's not me. So it's really important to really understand your patient's values. And so sometimes my husband's like, you're pestering your patient. You just keep on asking them why? And I was like, it's because they need to understand the why. I need to understand the why and their when. And if we both understand it, we're going to be successful. If we're on two different pages, one of us is not going to be happy.
Yeah, absolutely. I love that. That's fantastic. You're really setting the patient up for the best success that they can have by finding out what they think success is and then figuring out if you can help them with that. That's awesome. Well, thank you so much for all of this. I had one last question for you, and that is, if there was one thing that you could tell people to do that would be helpful that they could start doing right away, what would be that one thing? So tell me just a little bit about what you're learning about cranial.
So a lot of times I get asked, should I do rapid palatal expansion? Do I need the MARPE, which is like the surgical implants on the roof of your mouth, and that suture is cut open and then you're opened up and expanded? And how this has been taught to me by my mentors, again, this is my opinion and how they have been working, is that you have this system here. So you have your maxillary teeth, and then you have your nose that inserts up to here. Everything's all connected. So when you get a MARPE done or anything surgically done, what you're doing is you're splitting that open. Well, now the septum has to choose a side because it inserts and attaches from here to here. Now you've broken that attachment system, and now it has to choose a side. So yes, MARPE does help get more volume in the lower nasal passages, but it actually restricts volume in the upper nasal passages because of the tension, because you are doing this. And when you're opening, you're causing that to push harder on each other up at the top.
Okay.
So slow palatal expansion is what my mentors have told me that they prefer, because what it does is it's that slow and it allows that tension to be dispersed before opening up again. So now you're getting more of like this motion rather than this motion. And the septum is what causes the nitric oxide release, because the septum attaches down here at the vomer to up at the cribriform plate, and the tongue to the roof of the mouth causes that septum to pump just a little bit, and that pumping motion is what stimulates the cribriform plate to release the nitric oxide. So if you remove that attachment, now you're turning off the way that the nose breathing gives you nitric oxide.
Oh,
It
wow.
will reattach. I believe the system will turn back on, but you're temporarily turning it off, right? Because that septum is not just going to dangle and hang. It's going to choose one side or the other to go with. You split the path, it's going to go this way. You split it, it's going to go this way. It's not just going to dangle and hang. So that was just something interesting that I haven't ever thought about, because I'm always wondering why not go the surgical route, or why go the slow route, or other things. And within like cranial in mind and osteopathic considerations in mind. It's because it's of the torque that's put on the system that then shuts off the harmony of everything else because it all works together. So I think dentistry, we're pretty myopic. We deal in millimeters. We look at teeth all day long. We think, oh, doing this, it's going to open up. It does open up here, but what about everywhere else? What has to compensate in order to get that? And so, and then are you getting an osseous union, or are you getting just a soft tissue union? Is it scar tissue and everything else like that? So my preference is always, and my gut has always told me, let me try something non-surgical. And then when I heard all of this stuff, then I was like, that makes sense to me. And that makes sense to what my intuition was telling me with different things. And so I get expansion and development, non-surgical ways to allow disbursement of the tension along the sutures while still getting the alveolar process wider without cutting into that suture. And it's less invasive as well.
Yeah, absolutely. It that sounds much more comfortable rather than having one's mouth sliced into as well.
But lots of different ways to get from point A to point B. I see some of my colleagues doing beautiful MARPE work, and they're saying they're getting way increases in nasal breathing, which they probably are. So just different ways to skin a cat. But my idea, less invasive, and with all that measurement, yeah, you're getting that increase down here, but what about up here? Because a lot of people who get MARPEs, they say they start to get like more headaches, or there starts to be tension here. That totally makes sense because of how you're putting pressure onto that system.
That is very interesting. Yeah. So it's good to know that there's lots of options. So you mentioned chiropractic work just a little bit. Who are you training with to learn more about this?
Yeah, so all the cranial manipulations, all the stuff that I've learned about how the sutures work and how to get the head end torqued, I've learned through Dr. Bob Walker. He teaches the course Exceptional Exceptional Dental, and it's chirodontics. It's really cool because he's a chiropractor and his significant other is a dentist. And so they've figured out how to marry the two together and how to get the whole craniofacial system working better. And so I've just really loved learning more from him, and it's been a great addition to my practice.
That's awesome. Look at you putting all these systems together.
That's a great question because you want to see, hey, not everyone can come to Utah to come see me to get treatment. And so what can you do? I would want to verify a few other things first. So this is kind of not a one size fits all for everyone. I really like lip taping and the ability to breathe through your nose, because the nose warms, humidifies, and filters the air. And it helps you to posture your tongue onto the roof of your mouth. With your tongue onto the roof of your mouth, you are stimulating the vagus nerve. You're going out of this fight or flight and more into this rest and digest. And you're expanding the palate, and you're helping pump that system so that you can get some nitric oxide. Nitric oxide is a vasodilator. It helps your heart and your lungs work better, all by breathing through your nose. It's great. For someone who cannot breathe through their nose, I'm not going to tell you to lip tape your mouth right away. But for the majority of people, they actually can. And so try some lip tape. I like dollar store lip tape because it's not super sticky. So if you need to break it, you can. It's a little porous. For kids, I like the square Myo tape because they can still open their mouth and breathe, but it helps close their lips together, remind them to close their lips together. But then it's a really cheap way to help you breathe through your nose all night long. When you wake up, you feel more energized, more refreshed, and your nose is more open already, because the nose is a use it or lose it function. So the more that you breathe through your nose, the more that you have the ability to breathe through your nose. But what I start with patients is try wearing it a couple hours in the evening. And don't try it the first time when you have a cold and you're stuffy. That's the wrong time to give it a first go try. But try it in the evening. Prove to yourself that you can do it and it's just fine. Also, purposely open your mouth a little bit. See that it doesn't take a lot of force to like open your mouth, and you're not going to suffocate yourself, and you're going to be okay. the reason why I like to do all my work before is because with the X-ray I'll be able to see if you have a severely deviated septum, and I'm probably not going to give you that recommendation right off the bat with things. But the cheapest, easiest, most applicable way for the majority of people, I'm not saying 100% of people. Let me just clarify that. Lip tape. It's great.
That's fantastic. Awesome. Thank you so much, Dr. Brittany. I really, really appreciate this. This has been so fantastic. So much great information, and now people know where they can get started. And if they, if they want to come see you, you're in Alpine, Utah, and
Yeah.
they can get started.